Okay, so this is about endodontic disease, classification, causes, development, signs, and treatment. So these are just some examples with pulpitis, periapical abscesses. They're also, in the next slide, you have cysts and granulomas here. You have condensing osteitis here. And what else? You have apical periodontitis. Okay, so what are the clinical signs? I'll tell them myself. So it depends on the disease. So if we start with pulpitis, so this is the first example of the periodontic diseases. The tooth basically will bleed inside. So you can see, it's not easy to see, but this tooth is like discolored. So that means the tooth will end up being pink, purple, gray, black. It very much varies. So you'll also see hypersalivation, it says here, halitosis, and they don't tend to eat as much. Now with the periapical cysts, trying to find one, there we go. What you get is basically a fluid-filled oral mass in the gum. I would compare it to something like an ulcer, except rather than a lesion or a pit, you have like a swelling. And what happens is this cyst is full of an unerupted tooth, which is kind of gross. And what happens is it causes local destruction. You can even see in the x-ray, there's like a pit here. Yeah, it basically occurs if it's left, and it can lead to jaw fracture. Next, we have periapical granulomas. Let me find one. Yeah, I think I'll use both of these actually. So it's only, what happens is a secondary infection has led to some pain. So for example, here we have a fistula forming, but this is like, although it looks like it's under the eye, like there's been an injury to the eye, and that's usually the mistake owners see, it's actually from the tooth. Next, we have periapical abscesses. Yeah, here you go. So yeah, basically, before you even think about the lump, there are other clinical signs. You have halitosis. They tend to chew on one side because, yeah, you can imagine it's painful here. The tissue below the eye is inflamed, so again, it's mistaken for some kind of eye injury. And you can have a fistula in the gum, so it can be very similar to periapical granulomas. And the tooth may be broken, and what you might see in the gum is a draining tract in the gingiva. Yeah, there it is. Yeah, sorry. So this is just like maybe the inside of the mouth you'll see, and you'll see that also the tooth may be broken and there'll be a draining tract. Oh, sorry, in the gum, not in the tooth, with pus basically. So how do we treat this? Okay, well, it varies. Let me try and get you some surgeries. Okay, so the first type is a vital pulpotomy. So as the name suggests, it involves the pulp of the tooth, so the inside of the tooth. So basically you cut the crown. So this is the tooth you can see with a handpiece. We use like a high-speed burr with like a flat end to cut the end off, and we use sterile saline or chlorhexidine just to wash the region. Then we use a handpiece with a round or pear end to remove 5 millimeters of pulp in the tooth. So this is the round piece I mentioned, and yeah, you can see that it's getting rid of the pulp in that tooth. So in stage 2, sorry about that, you try and cause hemostasis, because let's face it, when you get rid of some of the pulp, which is where the blood is, it's going to like go everywhere, the blood, and it's going to not be helpful. So what you're trying to do in this stage 2, is hemostasis. So you do it by washing it out with lavage with sterile saline, and then you use dry paper points. So this basically looks like a toothpick, and use the blunt ends of this toothpick with calcium hydroxide, which is also like a drying agent. But you have to make sure, it's very important in this stage to remove all the pulp. Now, if the bleeding continues, the pulp is still there. So you have to continue to use these blunt ends and lavage. And you can even, if it won't stop bleeding, use local anesthetic, use epinephrine on the end of this pick. Calcium hydroxide is usually given in stage 3 at maybe about, 1 to 2 millimeters above the dry bits of the pulp. And then what you do is in the next stage, sorry about the zooming, you have to add an intermediate pulp. So what you have is pulp, calcium hydroxide, intermediate pulp. Intermediate filling. And this can be used with a glass ionomer, for example, over the calcium hydroxide paste you just stuck there. And finally use a handpiece with a flat end, so this isn't flat, but imagine it is, to sort of prepare the pulpar cavity and to basically restore the tooth crown. So I don't know if there is a fifth stage. Yeah, it is. So yeah, this is the flat end I was talking about. So you have your pulp, calcium hydroxide, glass ionomer, and you use this flat end here to basically prepare the end, and you fill it with filling basically to restore the tooth crown. The next one, sorry, this question's a bit long. Yeah, so they're just showing you the restoration. There is the indirect pulp capping, or root canal if you prefer to use that. So this is a technique that just restores the crown. It kind of can continue from the previous stage, but sometimes it's just used on its own. So basically you use sterile saline to sort of clean the area, not just the area, but where you're going to restore the tooth, and you have to air dry it. So basically, yeah, wash, air dry with saline, then use a Getz brush. It's not really shown here, but you basically use this to add a dentin conditioner, then air dry, then calcium hydroxide, which acts as an antiseptic. So it's not just a sealant used in the previous method, it's also quite clean. And basically you use the Getz brush to line the cavity and let it dry. So afterwards it will sort of, you can use a light cured glass ionomer. So yeah, this is the dentin tooth conditioner I already mentioned. And now you're adding your layer of calcium hydroxide and it acts as an antiseptic. Yeah, and then you have your light cured glass ionomer on top of your calcium hydroxide. And you can even put another glass ionomer on top of this to act as, say, for deeper restorations. And the tooth crown restoration, basically, you can use a composite for caries, glass ionomer, as I mentioned, but it depends. So if it's caries, use a composite, C for caries, C for composite. And if it's a resorptive lesion, which we'll talk about later, you'll use a glass ionomer. Now there is another technique called I think it's a pulpectomy. We already kind of talked about it. I don't see it here though. Sorry about that. All right, let's just use this. So it's basically where you remove the entire pulp. So this is in the case of an abscess, and you basically disinfect the inside so you can see the whole pulp has been washed out basically. Dried, then you fill it, which is also known as obturation, with a root canal sealer like zinc oxide, then access the site filled with restorative material. So yeah, pulpectomy is an example of a root canal therapy. There's also an apicoectomy, is that here? Sorry, I'm just trying to find it. Okay, I'll just use this picture again. Okay, so an apicoectomy is when you basically will get the gum and you lift it to access the bone and the tooth root. So just ignore the pulp inside, you're accessing the outside, and you basically clean it, fill it, and seal it. You can also do an extraction. For periapical cysts, what you'll do is remove the cyst lining. So if we go back to that cyst picture, let me find it for you. You basically will cut around it, so you remove the lining of the cyst, and then you'll curette, so scrape away any debris, and you can do a bone graft if there's severe local bone distraction. Now with the periapical granuloma, you do a root canal therapy. So basically clean out the root canal, as I mentioned, and extract the tooth to remove the infection and antibiotics. To be honest, we mostly do extractions, I think. But I think root canal therapies are also the gold standard. Now with abscesses, it's exactly the same treatment as granulomas. Always remember that periapical granulomas and abscesses always have the same therapy, root canal therapy, or extract the tooth to remove infection and use antibiotics.